Clinics in Guanac are promoting stem cell treatments for receding hairlines. But does the science hold up? What if baldness isn't permanent? A new study found that hair growth stem cells remain dormant even in bald scalps. This suggests the real problem isn't just genetics, but the shutdown of stem cell activity. And forget old transplants. The new methods are about simple injections, not scalpels. So how do we reactivate these sleeping cells? We'll break down the science, show the evidence, and reveal what's actually possible. First, let's establish the fundamental issue. As we age, our hair follicle stem cells' regenerative ability weakens, causing them to go dormant. The purpose of this therapy isn't to make new follicles from nothing. It's to send a wake-up call to the miniaturized ones already there. This method is fundamentally different from a hair transplant. It's minimally invasive, often just a series of tiny injections. This results in minimal to no scarring, and the recovery is extremely fast, often just days, not weeks. This is also not a temporary fix. The therapy aims to re-educate follicles for longer-term repair, unlike short-term boosts from PRP. But what exactly gets injected into the scalp? The answer is more sophisticated than you might imagine. Here's the key. Many advanced treatments don't use whole stem cells. They use the secretome, a cocktail of growth factors that the cells release. This signal soup is what reactivates follicles. So how does its potency stack up against a common treatment like PRP? To get this powerful mixture, clinics often use adipose-derived stem cells. These are easily and safely taken from a patient's own fat tissue. Here's the answer. The stem cell secretome can contain up to 34 times more growth factors than PRP. It's a far more concentrated signal. This works because the signals also do two other things. They promote new blood vessels for nutrients, and they calm scalp inflammation. This sounds great in theory, but does it produce actual results? Let's check the clinical evidence. A significant Italian study on male pattern baldness gave measurable proof. Patients saw a 29% average increase in hair density in 23 weeks. This is not an overnight fix, though. Initial changes typically appear around 4 to 6 months. The full foundational effects can take 12 to 18 months. The pharmaceutical world is also validating this method. A new drug, PP405, targets stem cell reactivation and is entering phase 3 trials. This technology isn't just for scalps. Its cellular-level action means it can also be used for eyebrows, beards, and even on scarred tissue. So, is this a miracle cure available tomorrow? Here is where a dose of realism is needed. The most vital point to know: as of 2026, no stem cell treatment for hair loss has full FDA approval. Most are considered investigational. It is also vital to remember what it's not doing. It is thickening and reactivating existing thin hairs. It is not creating new follicles on smooth skin. This connects directly back to that UVA study we mentioned. The treatment works because those key stem cells are already there, awaiting a signal. Due to this complexity, many professionals suggest combination therapies. Using stem cells with PRP can create an even better environment for regrowth. Let's connect all the pieces now. What is the big picture that has formed? We began with the finding that hair loss is caused by dormant stem cells. Then we learned that the secretome is a powerful signal to wake them up. This signal is vastly more potent, up to 34 times more than older treatments like PRP. This explains why studies show a 29% density increase. So the promise of this therapy for receding hairlines isn't magic. It's targeted biological communication to cells that are already present. This is why announcements from places like Guanac matter. They show a clinical shift from surgical procedures to regenerative medicine. So what are the main takeaways? First, hair loss is a problem of stem cell dormancy, not always permanent destruction. Second, modern treatments use powerful signals that show real, measurable results in studies. Third, the field is still developing, so patient education is key. The announcement of new hair loss services is more than a product launch. It's a sign that regenerative medicine is moving from labs to clinics. If you are considering this, do your research. Ask about the stem cell source, see before and afters, and consult a board-certified specialist.